When we test your lipid profile, often, of course, we check total cholesterol, we do LDL, HDL, but what many patients often don't think about is that it's very, very important also to check what we call the triglyceride. Now, in this video, we're going to talk about how can your triglyceride affect your overall health. So let's go into it right now. Hi, I'm Dr. Mura, a certified lifestyle medicine physician and co-founder of Dr. Mura Health. Dr. Mura Health, as you already know, is all about preventing, treating, and reversing lifestyle diseases, which is now everywhere. Talking about lifestyle diseases, there's an estimation of 70% of all the patients seeking medical attention, their core problem is lifestyle related, and that's how vast that is, which is good news as well, because if 70% of what you take patients to the hospital is a lifestyle related condition, so we can use the lifestyle changes to be able to, to treat and even reverse those conditions. Anyway, about triglyceride. Triglyceride is basically your major fat in your body. Now, this triglyceride is actually the food that we eat. Also, and then it is stored in the adipocytes, in the muscles, and the liver. Of course, the triglyceride can be both unsaturated and saturated, but the mainly saturated one is the one that end up causing too much problem. And the dietary sources of saturated fats is cheese, conventional desserts, red meat, and processed meat. When you eat saturated fats, and then that's combined with, of course, with the cholesterol, and then the triglyceride combined with the cholesterol is going to worsen the endothelial injury and bring all the cascades that we saw in a previous video. By the way, if you would have missed that video, please go check it out, because it's very important. It's going to help you understand as we talk more about the heart disease. You have high cholesterol and then you have high triglyceride. The complication is even worsened. Another source of triglyceride is from simple sugars. What we call the empty calories, like sugar, fructose, and so on. When you take it, the body changes that sugar. If you take that as simple sugar and you're not ready to use it, the body changes that through the process called the de novo lipogenesis into fat, so that energy can be used later on. So, having said that, the complex whole food complex carbohydrate does not cause the same effect. So, it's very simple. To be able to reduce your cholesterol problems, one just need to change to minimize animal intake, because, like we said in our previous video, the only source of cholesterol is basically from animal food. So, if you can reduce that, then the body is likely to only use the cholesterol that it needs. And the good news is, when you reduce that, the food or the lifestyle that it tends to reduce cholesterol will also help with reducing triglyceride. Of course, eating whole food, not eating simple sugars, trying to reduce the processed food, trying to reduce the cheeses, the processed meat, and so on. Of course, the red meat, which is overall issue in hypertension, diabetes, and in all conditions. So anyway, so I thought I should bring that in. Triglyceride is very important to monitor as well, and there is always something that we can do. So stay tuned as we talk more on heart disease.